Hello viewers, welcome to our Facebook live session. Today we'll be discussing about prostate cancer and its treatment, and we have with us our specialist Dr. Ashwin Tamhankar, consultant Uro-Oncologist at Apollo Hospitals, Navi Mumbai. Welcome to our Facebook live session, doctor.
Good afternoon, everyone.
The first question is, what is prostate cancer? Can you explain?
Yeah. So the prostate, basically, it's a cancer arising from a prostate gland. If I can tell you about the prostate gland, it's a small gland, walnut-shaped gland sitting next to the bladder, between the bladder and the urethra, and anterior to the rectum. Generally, the function of that gland is to produce fluid which helps spermatozoa to mature, as whenever the gentleman is in a younger age group. But obviously, as and when one gets older, the functionality of the prostate gland reduces apart from forming a bulb to the semen. So any cancer coming from prostate would be prostate cancer.
So how common is this cancer seen?
Yeah. So if you consider Western literature, it's quite common. In the global data, I guess it's the second most common cancer in men. Obviously, in Indian scenario, generally we have around 7.5 to 8 gentlemen getting diagnosed with this cancer per 100,000 population per year. But I'll be honest, this majority of this would be slightly underreported because of lack of adequate screening in India.
What are the symptoms of prostate cancer in men?
So generally, prostate cancer arises on a background enlargement of a prostate, which is called as benign prostatic hypertrophy or benign prostatic hypoplasia. It generally happens with the age. Every gentleman after certain age is bound to have certain enlargement of the prostate. And whenever cancer arises on this background, it leads to cancerous growth inside the prostate. So per se, whenever the cancer is restricted to the prostate, there are no symptoms per se because of the cancer. But obviously, as I said, it arises on the background of enlargement of the prostate that leads to certain problems while passing urine. If I can quickly summarize one or two of those symptoms, it would be frequency of urination. That means you need to go early to the loo. Urgency of urination. That means you may not be able to hold the urine or may not be able to postpone the urination. You may have to get up in the night time, say around 2 to 3 times in a night time, and obviously the stream of the urine may be poor and you need to strain. Rarely it may manifest with blood in the urine, but it's a very rare occurrence. And if you imagine, once the cancer comes out of the prostate and goes to different parts of the body, especially it has a very high propensity to go to the bones, especially the ones in the vertebral column, that is the spinal column. So sometimes the bone pains or rarely fractures may be the manifestation of this particular cancer, but that happens only in late stages. Yeah.
So doctor, is this cancer seen in hereditary?
So generally speaking, actual hereditary cancer is about only 9 to 10%. Hereditary cancer, the genetics of a cancer, obviously it's an evolving science for every cancer, especially for prostate cancer. There are many genes which are found to be associated with it. But especially certain genes like BRCA2 genes, which are also associated with cancers like breast cancer, ovarian cancers in females, they have certain association with prostate cancer. And the germline mutations which happen by the origin of the birth or because of the ideal hereditary situation would amount to about 9%. Majority of the other genetic mutations are called somatic mutations, which happen after the birth.
So what are the lifestyle precautions which can be taken to prevent this cancer?
Yeah. So generally saying, prostate cancer doesn't have direct implication to any dietary factors. Luckily, smoking doesn't have a direct role to play in carcinogenesis or generation of a cancer. But obviously, smoking does have implications when the patient actually undergoes a treatment in terms of adverse effects. But to be honest, there are no defined parameters or defined dietary factors, but it's always worthwhile to have adequate precautions in terms of keeping good habits in terms of having regular exercises. You can have lots of vegetables or lycopenes, that is cooked tomatoes, fresh fruits. All these factors would probably give you some benefit rather than harm in general for every other cancer.
So how do we pick up this cancer at the early stage?
Yeah. So it is more of a screening modality. Essentially, to answer this question, we have to understand what screening is. Screening basically is a modality in which a healthy population is being screened to rule out a particular cancer. That stands true for every cancer. For prostatic cancer, a screening modality is very well established in Western literature and in Western population. There are two ways of screening screening for the prostate cancer. One is a physical examination for the prostate, and second is a blood test called prostate-specific antigen. In short, it is called as PSA levels. So above certain cutoff, for example, a cutoff of around 4 nanograms per ml in a gentleman after 50s or 55 years would be considered abnormal, and that needs to be looked into details for further evaluation. So a screening essentially is important to rule out or to pick up the diagnosis, pick up the cancers at early stage.
Is prostate cancer curable?
Yes, prostate cancer certainly is curable entity, but for that probably I would probably explain you the details about any carcinogenesis. That stands true for every cancer. Generally, there will be a finite period of time when the cancer would be lying or located in the particular organ. After that, there will be a phase of loco-regional spread in which the cancer cells will come out of the capsule of the organ, go to the adjacent areas, and eventually they would go to the different parts of the body and form a metastasis, and in which the cancer gets to a stage 4 cancer. It's simply stating it is like a seed and soil theory. If the small cells of the body or the small cells of the cancer particularly go into a different body part and they have a fertile soil there, then they are bound to form some conglomerate which are called metastasis. So whenever a prostate cancer is detected in an early stage, when it is localized to the prostate or localized to the prostate and the adjacent areas, then the prostate cancer is certainly curable. Yes.
So how does robotic surgery work for prostate cancer?
Yeah. So ideally speaking, for a prostate cancer management, there are two ways of managing with an intention of cure. Basically, we have to understand whether the treatment is with an intention of cure or whether the treatment is with an intention of control. Whenever the cancer is loco-regional in its presentation, then the intention of the treatment is for cure. Whenever the cancer goes outside in the form of metastasis or a stage 4 cancer, the treatment obviously would be to have a better control to maintain adequate quality of life, and the cure is not possible in that situation. So for a cure, there are two modalities of management. One is surgery and second is radiation along with hormones. I'll be discussing about surgery quickly here. Surgery essentially is to take out the entire prostate and the seminal vesicles. These are the glands sitting next to the prostate, along with the local pelvic lymph nodes, depending upon the indications. Conventionally, this surgery was performed. It is called as radical prostatectomy. So the conventional approach to this procedure was an open approach that was called open radical prostatectomy. But with the era of miniaturization, with the era of keyhole surgeries, especially the robotic surgery, starting from year 2000 when the first robotic prostatectomy was performed in US, there has been a sea change in a robotic armamentarium for the prostate cancer management. A particular company, which is Da Vinci robotic system, which that there are multiple generations of this particular robotic system available till now, and every other modification or every other modification would give us some extra advantage in terms of operating benefits. So robotic surgery per se is a keyhole surgery in which a surgeon or a chief operating surgeon sits on a robotic console where he has a 3-dimensional magnified vision. Then he controls entire movement on the surgeon console, which is completely reciprocated exactly in a similar manner inside the body of the patient, where the robot would be docked on the side of the patient and the instruments would be attached to the robot. Every movement is completely guided by the surgeon. The robot doesn't have any role to play as an autonomous entity here. The advantages of this particular procedure can be a 3-dimensional magnified vision, hence reciprocating into better precision, lesser blood loss, lesser chances of blood transfusion, early post-operative recovery, and early post-hospital discharge. If you can imagine, a patient of a robotic procedure, robotic prostate surgery, generally starts walking around on the same evening of the procedure. He started on a diet on the same evening of the procedure, and majority of them would go out of the hospital on the very next day. So only a hospital discharge of maximum 1 or 2 days. And if you compare this with the previous open surgery, there would be a big scar on the tummy in open surgery, and the patient would probably stay in hospital for 5-6 days. So there is a lot of difference in amongst recovery phase. and precision for both the procedures.
We come to the last question. What all branches are involved in managing this cancer?
Yeah. So as if you have heard me in the previous talks, it's always a team approach. So it's a DMG, that is disease management group approach. Obviously, prostate cancer, if you remember, I have already discussed curative modality of intent is either surgery or a radiation. Uro-Oncologist or a robotic surgeon has a pivotal role to play in this management, in this cancer management, obviously. And along with that, radiation oncologist or a medical oncologist would be helping him out in different stages. Obviously, in late stages when the cancer comes out, the management of a surgical modality is slightly less important, and a medical oncologist role is more pivotal there. Along with that, the other team which helps us to understand about the staging, that is whether the cancer is still inside the prostate or has gone beyond the prostate, would be decided by basically we need an imaging for that, and that would be taken care of by the radiologist or the radiation or the nucleophysicists. I guess so. It's a complete comprehensive approach as a team effort, and for better cure and better results.
Thank you, Doctor, for joining this session. Dear viewers, if you have any question related to this topic, please drop your questions in the comment box and we'll address it to Dr. Ashwin. Thank you.